Hello, my name is Dr. Jeffrey Barsuk. I am the Robert Hershtick Professor of Medicine and Medical Education at Northwestern University Feinberg School of Medicine. I currently serve as the Executive Medical Director of Northwestern Simulation. I'd like to welcome you back to yet another podcast in our series on simulation and healthcare education. In this podcast, we will continue to discuss key issues in nursing simulation. Today, I have the distinct honor of interviewing Dr. Nicole Harder. Nicole is the Associate Dean and Associate Professor at the College of Nursing at the University of Manitoba. She is also the Mindermar Professor in Human Simulation at the Rady Faculty of Health Sciences. Dr. Harder also serves as the Editor-in-Chief for the peer-reviewed journal Clincial Simulation in Nursing. Nicole, it's an honor to interview you today.
Oh, thank you very much. Great to be here.
So we always start our podcasts with a little bit of background on our interviewee and how you got involved in simulation.
Great. It was almost serendipitous because really it was my first experience as a simulation participant that led me to be involved in simulation. And I think that's probably the same with most of us. So what I was, at the time I was working as a women's health nurse practitioner with the Canadian military and was at a military conference and they were showcasing sim. And this is way back when it was new and we were all oohing and awing over everything. So I won't get into all the details, but what was interesting is that we were not the best simulation participants because I think we actually ended up killing our patient. They went into anaphylaxis and they ended up dying. And in large part, it's because we didn't know each other as team members and a whole comedy of errors. But I just remember saying under my breath, just call it and let's try again. And just call it, let's try again. Without really knowing that there were people that were listening in the debrief room that could hear me. So they came out. We all had a good laugh. But what it really did, though, is it hooked me. And I really saw firsthand, like, wow, this has a lot of potential because my own, your heart rate gets going and you're anxious and you're not doing things the way that you should be doing. But along the same time, I was also a PhD student. And so given my experience in sim, I really wanted to explore that a little bit more and started to look at how I could maybe integrate simulation into my studies. And so I really wanted to figure out how we learn in simulation. And that's what I ended up doing. And then for my dissertation, and then took that back with me when I started my positions in nursing academia.
So that's a good place. Maybe we can talk a little bit about what you did for your dissertation and your PhD work, since it led to your eventual career in simulation.
Sure. So what I was doing was looking at how we learn. And this is before we knew anything about, how much time to spend in simulation, what the group size should be in simulation, even really how to properly debrief simulation. So what I was asking was just essentially those questions. What are some of the elements that my students were experiencing in sim that really helped them with learning? And a lot of it, it was also very affirming because a lot of it still stands true today. We're talking about 15 years ago. But essentially it were things like having the small groups and being able to make mistakes and having your team members being able to be, even in those observer roles and being able to watch your team members make mistakes. So it's just interesting to see how some of that is still what we do today.
And then, of course, now you serve as the Associate Dean at the University of Manitoba School of Nursing. So let's talk about your role there and then how simulation ties into that, if you could, please.
Sure, absolutely. So you're right. I do have the privilege of serving as the Associate Dean. Our program has both midwifery and undergraduate nursing programs, and we have about 1,100 students, undergraduate students. We recently expanded our program because we know there's a national nursing shortage, actually more like an international nursing shortage. And so in the associate dean role, I mean, of course, a lot of that is administrative. So looking at any kind of student issues, faculty issues. But what I'm really fortunate to be able to do is in this position is really support our simulation program in a more formal way. And so this is what I mean. So we have a concept-based curriculum that has we've replaced approximately 25% of our clinical practice hours with simulation. And in one of our particular classes, mostly with surgery rotations, we've replaced 50% of our clinical practice hours. We call them off-campus and on-campus clinical. So because we have such a huge amount of simulation-based experiences with our students, what I'm able to do as the associate dean is really support that. And I think that with my background in simulation, I'm really able to work with our simulation team, because it does take a team, to really support the work that they're doing. And what has led, or what happened because of that, is I think we were able to advance things quite quickly. So for example, we have a virtual reality lab, augmented reality lab. I'm part of a larger faculty that has colleges in nursing, medicine, dentistry, rehab sciences, and pharmacy. And what we're able to do because of our large simulation team here in nursing is we're really able to liaise with the other colleges and do more interprofessional types of simulations. And we're scattered across several campuses. So even though in my role, it is kind of double duty, meaning I'm in administration and a simulationist, I think that it's a great opportunity to really advance the science of simulation, because I have leverage, I'll say, because I'm on both sides of the discussion. So it's really, really helpful for our colleges, for all of our colleges at my program.
And that's key. I'll tell you, as the director of our Sim Center at Northwestern, having the support of the dean's office is huge for everything we do. And I'm fortunate to have that support within the dean's office as well. So I totally appreciate that comment. But nursing simulation does have some unique challenges that may not be faced with other health professions education. And I think it's really cool that you get to be integrated with the other schools so that you can do interdisciplinary training. But I experience some unique challenges when I bring nurses into our simulation lab for interdisciplinary training. I just want to see what your perspective is on those unique challenges that you might see in a different environment.
Sure. So I'll chat a little bit about the interprofessional opportunities we have, but before I do that, what I'm finding, and it's not unique just to my program, but I think what we're all finding is that how we're using simulation is changing. So, for example, we all know that we have a healthcare provider shortage, particularly with nursing. It's becoming a little bit more of a global concern. And so what we're starting to see is that we are having concerns with shortages at the front lines. So with our new grads that we're trying to get out there, but also with faculty. And so we're starting to see faculty starting to retire, and we're not necessarily getting new faculty to join us at the same rate as those that are retiring. So what's happening is that we are experiencing a nursing faculty shortage as well. So not just the nurses at the front line, but faculty. And so what that means is everything from clinical instructors all the way to researchers and everything in between. We're just having less people. So what that really does, though, is that limits our ability to graduate more nurses. We do need clinical placements. We need the hospitals to be able to, to accommodate our students as they go through these different placements. And right now, they're struggling with really being able to do that. And that's actually one of the reasons why, especially in surgery, we had increased the amount of simulation time that we're doing, because with our program expansion, there was just no possible way to get everybody through the placements in the time that we had promised the students that we'd be able to do. So there's a few challenges like that. Along the same time, I'm hearing from some of our practice partners that our students just aren't ready. And what they mean is they're not talking about psychomotor skills, and they don't mean academic knowledge or anything like that. What they're meaning is that they're just not ready for the environment. So they don't necessarily have the coping skills, the resiliency. They haven't developed that yet because they're still pretty green. So what we're finding is because they don't necessarily feel prepared, is some of them are considering leaving the profession altogether, which is, very, very sad to hear. And most of them are just not wanting to have more than, a 0.7, like they don't want a full-time EFT. So because of that whole transition into practice, what we're trying to look at is how can we use simulation to be able to bridge some of those gaps. And so that's what we're starting to do a little bit more of. So for example, we know that there's a lot of incivility in the workplace. There's a lot of bullying. Patients' families mostly are not exactly nice to our nurses. And so that has really influenced how we are starting to create and research some of our simulation experiences. So just to use that example I just gave you, bullying and incivility. So we do have simulations that deal with that, as well as other kinds of simulations that deal with racism and stereotypes, how to call those out. We talk about suicide and unexpected patient deaths, all those types of activities or those experiences, I should say, that are really emotionally and psychologically stressful. And so we've changed the way we do our sim. It's not just about being able to, have a team respond to a code. And I know we do so much more than that, but that's how we've kind of changed our sim program to include more of these really challenging types of experiences to develop some of that coping and resiliency with our students. But that also has changed a few things. It really changes, or we as faculty need to change the way that we debrief those simulations, because all of our current models are really based on education frameworks. And what I mean by that is they're looking at how have we achieved the learning outcomes. So you have your set of learning outcomes in your sim, how we achieved them. What are some of the, the little rabbit trails that students took during the sim or the participants took during the sim, and, making sure that we all leave with a shared understanding of what we're supposed to accomplish there. So we do have that most, and we all know this, but most of the debriefing frameworks, they have the reaction, the analysis, and then the summary phase. And we kind of just skip over the reaction phase. Like it's important, but we don't dwell there. What we do when we have these different kinds of simulations is that's the large bulk of the debriefing. And so we've created a trauma-informed, psychologically safe debriefing framework, or TIPS is what we call it. And it really just flips that reaction and the analysis phase where we spend more time looking at how are you feeling in this simulation? What's the normal feelings after something like this? When is it a little bit excessive? When do you need to seek help? And those kinds of things. It's not therapy. And I know some people are not comfortable debriefing those type of experiences because they say, well, I'm not a therapist, I'm not a counselor, but you don't need to be. It's just a way to sort of normalize the feelings that people are having. So things are really changing in the way we're doing simulation. And I think that's the way we're going to really advance the uses of simulation and then the research in simulation as well, the whole science of simulation.
Yeah, I mean, we're doing a project at Northwestern in pediatric anesthesiology right now that's getting underway about difficult conversations and breaking bad news to patients. And kind of just as what you're saying, there's a lot of burnout among practitioners, whether they're nurses or physicians. And a lot of it seems to be related to these difficult communication scenarios or scenarios where you have to interact with the family. And training around it, one of the things we're going to look at, and I'm sure you are too, is going to be looking at burnout rates and burnout scores. Do you have any data yet for any of this, or are you seeing anything?
We are running a couple of studies right now. And I think you're right. There's a couple of really good tools out there. Like I think this is unfortunate that Maslow's burnout inventory scale is specific for healthcare providers. And it just demonstrates like how important that work is and how prevalent it is. And so what we are finding is that they are able to sort of shift how they're thinking. They're not shying away from these experiences after they go through these simulations. And so that's an important part. But what we'll need to do is something a little bit more, not necessarily longitudinal, because then there are so many other confounding factors that happen between, time 1 and time 2. But at the same time, just to go back to these students now that they're practitioners and seeing if that has helped. So we're just starting to do the recruitment for that. We had planned to do that pre-COVID, and like everybody, of course, that got put on hold a bit. But we're right now targeting palliative care units, mostly because that's I don't want to say it's not an easy unit, not at all, but we know that there's going to be, there's an expectation that there will be death. Before we get into places like emerge departments, we'll just start with something where it's a little bit more controlled, and then from there, see if we can replicate that in other departments.
So in some of my other podcast interviews with nursing leaders in simulation, we've discussed the psychologically safe learning environment in nursing sim. And a lot of concerns that I see now in practicing nurses, that when we run an in situ interdisciplinary sim, the nurses tend to be very anxious because of memories they have from what they went through in nursing school. And in fact, the admin director of our sim lab is a nurse and remembers horror stories about when she went through simulation. And are we beyond that yet, do you think, or do we still have issues with creating safe learning environments within nursing sim?
I would like to say we're beyond it, but what we're finding is that there's still a lot of people that have not really, they're not really immersed in simulation yet. They're maybe just started, or maybe because of the pandemic, they were forced to go to look at simulation. And so they're not necessarily versed in the pedagogies that accompany simulation learning. So what I find is that, especially in those cases, they don't know what they don't know, right? And with so many programs that are running, it's very easy to find places where people don't know what they don't know. There's also been, and again, due to the pandemic, there's also been quite a bit of limited funding for people to do professional development and additional learning, just in general. And that's just because, budgets are what they are, they're budgets. And so we're finding that there's also people who their learning is really, they read an article, or they, listen to a podcast or watch YouTube or whatever, which there's nothing wrong with that, but it's not the same as, some of that really, in-depth type of professional development learning that can go on. And so I think it's not that people are intentionally creating an unsafe environment. They just don't realize that they are. So we have a little bit of, and the reason I'm saying that is I still, as the editor for the journal, I still read papers where I can tell that there's a good intent behind it, but maybe they don't know about the standards of best practice, and maybe they haven't necessarily heard about how to create the safe learning environment beyond saying this is a safe learning environment. And, without knowing that it starts right from the way that they pre-brief all the way to how they interact with students at the very last minute of the debrief, so. But
what I hear that you say you're doing in your sim center already gives me optimism that it's changing, because you're already talking. I mean, you have to have a safer learning environment to be able to have these conversations around death and dying and racism with your students. I mean, there's no doubt, because if it wasn't safe, no one would be talking. So right. It's encouraging to me. So you mentioned your role with the journal. So certainly you are the editor-in-chief of Clinical Simulation in Nursing, and I have had the honor of publishing in that journal. I think it's a great journal. But can you talk to me a little bit about, I know what you do as an editor, but what are you looking for now? What's hot in nursing simulation research that you really are looking to publish now?
First, I can only publish what people write. And so this is my sort of plea for anybody out there. If you're doing anything that is neat, novel, everything in between, consider writing it up. And it doesn't have to be a lengthy article. I think too many times people think that they have to have this, robust, well, you always need robust research, but that everything has to be a research study. We have an innovations and simulations section that is essentially that. What kind of innovations are you engaged in? It does have to be an academic paper, obviously, because it is an academic journal. But I think sometimes we're just afraid to put our work out there because it is personal and you do get rejected. And And I have been rejected so many times, and even from my own journal, many times over. And so that's just part of writing, and you get great feedback. And so then try again. So first I'll tell you what we're not looking for. And in large part, I think this is when we first had the pandemic, everybody shifted to online learning and virtual simulation, et cetera. And so a lot of people did do studies on the activities that they were doing. And they reported on their experiences, and we did publish a few. But what we're finding is people are still submitting those kinds of works. And it's not that I'm not interested in people's experiences. That's not it. But what we're more interested in is, how did you learn from that? Because we've published numerous, everybody transitioned. We all had to do it. And so what we're more interested in is, what are those lessons learned, and how did you take that transition from in-person to virtual, telesimulation, whatever? How have you learned from that, and how are you now integrating that into your practices of simulation? Because again, that was a big shift, right? So that can give us maybe some additional ideas, strategies as we're moving forward with our sim now. I think what we're also seeing is there's a lot more people doing things with extended reality, virtual reality, artificial intelligence. And so I'm just starting to get a smattering of manuscripts that are dealing with that. And so I think there's two arms to that. There's one, the innovation piece, which will be really, really cool and interesting. But what I'm also going to be, interested in seeing is if people are starting to compare the different modalities in simulation, because now we're starting to get quite a few other modalities. What are some of those similarities? How are people learning in these environments? And how are they taking advantage of these learning environments in different ways? So, for example, I talked about us being a large faculty with multiple campuses. So we're starting to use virtual reality on all our campuses to do interprofessional education, mostly around biases and stereotypes and those kinds of things, because we can. Now we don't have that barrier of physical locations. And so that's going to be really, really cool to see. And then the last thing is that we also currently have a call for a special issue. So Clincial will publish a special issue usually once or twice a year. And right now the call is on interdisciplinary work. And just so I'm clear, it's not interprofessional, it's really interdisciplinary. So it doesn't have to be, it could be somebody from counseling or clinical psychology who's working with pharmacy or whoever, it doesn't really matter. But what we're looking at with this call is papers from experts, whoever, from all these different fields where they can bring their unique perspectives, methodologies, insights, whatever, to healthcare simulation. So they could be, like I said, they could be studies, they could be reviews, or any other piece that advances the science of simulation. And that's really because there's a lot of richness that can be had by having interdisciplinary groups working on simulation. So you could have your sim participants could all be the same discipline. That's fine. But having those who have designed it, who debrief it, might be a bit different. So that one is currently up. You can just go to our website and you'll see the call for the special issue papers there.
The interdisciplinary simulation educational interventions are huge in my mind. I believe someone's eventually going to do a study that shows this. I don't think it's been done yet, to prove that it actually makes the safety culture better. I don't think any of us are doubters on that because we see it, but I don't think it's actually been evaluated. So I think interdisciplinary training is a big, big topic in sim. So I agree right there on that topic. And then obviously AI, augmented reality, virtual reality, that is going to take over the world very rapidly, and we're going to have to learn how to deal with it. The machines are going to outgrow the humans pretty soon, and we're going to have to figure out how to integrate them. But that's really awesome stuff. And one of the misconceptions, I think, too, is that you have to be a nurse to publish in that journal. And that's not true at all, because I'm a physician and I've published in that journal, and I feel it's a great forum for publication. So I just want to get that out there too. So one of the advantages I've had is I've been able to talk to a few now nurse leaders in simulation. And one of the things that is starting to come out, at least to me, is that there seem to be silos between nurses, physicians, APP, research. And it also seems that, physicians aren't aware of the nursing literature. The nurses aren't as aware of the physician literature. And some of the areas that the physicians have addressed, the nurses are now navigating and haven't looked at the literature where how the physicians handled it, and vice versa. So what are your thoughts on that? Do you see that as the editor in the journal or in your practice?
Yeah, exactly. And that's so unfortunate, because I think, so those of us that are as editors, we talk amongst each other and look at things like that, like what are you publishing, what are you seeing, what would you like to see, that kind of thing. And we do make comments like that, like, that all of us indicate in our call for papers that we are interested in interprofessional studies. It's not just one discipline. For example, my journal, just nursing in the title, right away, people probably don't read it, right? Because it says clinical simulation in nursing. So that's something that, I can't really change, but what we can do is, when you do have these papers that are interdisciplinary, like I said, this new call that's coming out for interdisciplinary papers is to really start to highlight those, in a meaningful way, because, I think we tend to go with what we know, right? And so we write with people that we know who tend to be from our same discipline. We publish in journals that we know we've had success, which tend to be, discipline specific. And we kind of forget about some of these other ones. And what I'm hoping will happen is that with more of us doing interdisciplinary work, that we'll start to think about, okay, why don't I publish in your journal or in your discipline's journal? And why don't you publish in, my nursing journal? That kind of thing. Start to share those ideas a little bit more. But I think it's getting better, but it has a long way to go.
I mean, even if you look at the IMSH conference that we all go to, the physicians tend to go to the physician-based workshops and the nurses tend to go to the nursing. There is some crossover, but I'd like to see more and more of that, and maybe that's a forum to try and bring everyone together and review the important articles for the year. I don't have the answer. I'm hoping AI will solve it, since it will be the solution to all of our problems, but who knows?
Yeah. Well, and that's a good point, is even with some of the sessions, if the objectives are so specific to a discipline, that's what you're going to attract, right? And so maybe open that up a little bit and change, we're the only way forward or out of this is that we have to be make these concerted efforts to include others. If I'm in nursing, to make sure that I invite others who are from other disciplines to work with me, and to be comfortable with publishing outside of my own discipline. And I mean, that's a whole another talk. But just in terms of, where do you publish? So.
Yeah. And, my mentor, one of my mentors, Bill McGahey, has always highlighted the point that healthcare providers do not work solo. They work in teams. And can't emphasize that enough, is that when we think of simulations, they have to be inter and intra-disciplinary so that we can make them as good as they can be.
Yeah, absolutely.
Let's talk about research now, because certainly research is what not always are the articles in the journal research. Because, as you said, people do excellent work, but they don't always write it up, unfortunately, to share with the world. But as far as research goes, I think that it's really hard to find support, either from a government level or from a private level, financially, to support the research that we do in simulation. So what mechanisms do you look at that are unique, maybe in Canada, that aren't available in the United States, or worldwide, or industry help, or how do you look at that to help fund your research?
Yeah. Yeah, absolutely. But you're right. This is a challenge for all of us. And I think anybody who tries to obtain funding for things that are just purely about the simulation, I'll call it, you're going to have a really tough time finding anybody to fund that. So I think most of us have started to be really creative. And for example, what I started to do is partner with some of my colleagues and ask them to consider using simulation as part of their knowledge translation strategies. So let's say if they have, one in particular was doing research on new immigrant and refugees access to healthcare services. That's not something that I have expertise in, but one of the things that they wanted to do once they've done the reviews and the study, et cetera, is that KT project will be creating a virtual simulation for people, for practitioners, and sort of, work through it that way. And so that's my way to sort of tack on my sim arm to some of those activities. And then, of course, you build that into the budget. So that way we can kind of do a study within a study, if that makes sense. And so it's trying to be really strategic about that. Taking the lens of patient safety is also, I think, one that most people have been kind of successful at. So that's another strategy. But right now, what I'm thinking, I haven't submitted anything yet, is with health human resource development. So like I said, we know that we have a need for healthcare practitioners out there. If we can create something, some kind of sim program, whatever that looks like, and evaluate that, is I think we could probably be successful with some of that human resource development pots of money that might be available. But I think where our research is a little bit different than others is that it's intervention research. And what I mean by that is we have to create the intervention, i.e. create the sim, and then evaluate it. So there's always that one extra step. And so, and that step also needs funds. And so it's just finding ways to fund your project from beginning to end. And if you can partner, I cannot stress this enough. Partnering is so key. And I'm sure a lot of the funding agencies worldwide are starting to ask any potential researcher to have interprofessional or interdisciplinary teams working on that. I know with a lot of projects that I've been working on, if we can't demonstrate that we have different disciplines working on this, we're not going to get funded. And it has to be deliberate, not just, tokenism.
Right. Like the very same topics, I think, too, that you said that you're looking for in research in the journal are some of the same topics that are going to be funded now, DEI, interdisciplinary training, and addressing AI issues as they come up and how we integrate that into education. Are there any specific funding mechanisms that you usually apply to or look at very carefully?
Yes and no. I mean, of course, with us here in Canada, it's called the CHR. So that's the Canadian Institute for Health Research, which is kind of the equivalent to the NIH. Those are the ones that you kind of, they're long shots, but you submit them every year just, because you never know. This might be your year. But recently I've been doing more in scholarship of teaching and learning. And again, with that human resource development. So I said I haven't really applied, but what I mean by that is, some of those big pots of money, but have been working with work integrated learning projects. And so you just have to be strategic with how you're building all of these. And that's the nice thing about doing intervention research. You can get like a small local grant. Local meaning you might have a teaching type of support through your university, right? And so then creating something, maybe that's how you create the sim itself, and then building it out through there. But I'm finding it's getting even more challenging as times are going on. So we just have to be really, not necessarily getting the $1 million or $2 million and being okay with 50,000 or even 5,000. You can do a lot of damage with $5,000, right? And so and working through that way. But I wish there was a magic formula somewhere, but if there's one, I haven't found it.
Well, I would love for the governments, whichever country it is, or somebody to create a specific institute for education or higher education that could fund innovative research, because as you know, especially in simulation, there are not the multi-center trials that would slam dunk some of these interventions we know work. They're mostly one-offs. It worked at my institution. It may work at another institution, but a multi-center randomized trial, that's very difficult to do both financially and logistically in simulation. And one of the things that I hope to work with the Society for Simulation and Healthcare on is to get that rolling, but we'll see how that pans out in the future, because we could do international studies in sim if we could find the proper funders for it.
Yeah, no, I agree. And sorry, I didn't mention that, but both in Axel and SSH, they have grants that are available. But I've not been part of those review panels, but I am probably fairly certain that there's quite a bit of competition for even those, because there's just so few groups that fund simulation research.
And they're not often big dollars, like you said, but you're right. You can do a lot locally for the small dollars, but to do the multi-center trials with the travel that's involved in the data coordinating centers, it's near impossible. Let's talk about your research. Is there any particular hot thing that you're doing right now that you'd like to talk about and highlight?
Yeah, I think kind of going back to what I was saying before is we're really doing a disservice to our learners if we don't start to include more simulations that are challenging simulations, meaning the emotionally or psychologically stressful simulations. And like I said before, I know it's because most of us don't feel comfortable with debriefing them. Like I said, I'm not a counselor. I'm not a clinical psychologist. I'm just a nurse who has, regular nursing training. But you don't need to be all those other things to be able to debrief those experiences. And so that's what I think I'll be working on for the next short little while, because there's just so much that has changed over the last couple of years. Our students, most of them learned through Zoom, right? Like they were doing their studies were interrupted. And so they just don't have those same kinds of social and interpersonal skills. And we are really doing them a disservice if we don't try to integrate more of that. And I know, I'm sure many of us have colleagues that say, well, there's no way I can give up my class time. There's this content that there's no way they'll ever learn it if they don't hear it coming out of my mouth. Well, that's not true. We know that students learn sometimes in spite of us. And so just to be able to create more of those challenging simulations. But then also to be able to share that with each other. And so one thing that I've really appreciated about the simulation community is we're more than happy to share our scenarios, share our methods, and to really work together to try to get some of this work off the ground. So as soon as I do have some more data that sort of demonstrates that this is becoming effective, like I said, right now, our early work is just saying that students are not shying away from these type of experiences. They're not, hiding in the med room or, reading the chart again because they don't want to interact with their patients or the situations. But the next part will be okay, so are they, this in my perfect world, they'll be able to do a mini self debrief after any clinical events that they have as practitioners. And so you don't need to wait for, the critical incident stress debriefing team to come Tuesday at 9 a.m. right after we've had it. How can you develop those skills, those self-debriefing skills, so that way you can go see your next patient who's still waiting for you, even though you've just recently experienced this traumatic event. And I think we can do that in simulation, but it's just going to take a little bit of time.
So here's the tough question. How are you going to measure the success of that program?
Oh, goodness. I need people smarter than me to work with me on that one. But again, that's where you need the interdisciplinary teams. You need this is where I need the clinical psychologists and the folks from the critical incident stress debriefing team, like all of the people, because this is not a one person or even a one discipline issue.
And that can't be emphasized enough. I can't tell you how many times I've gone over to the social sciences department and had a trained psychologist help me. And they come up with a tool that's already been developed and shown to create valid and reliable data that can measure these very things. So I was hoping you'd give me the magic answer and say, this is the tool we're going to use, but it sounds like it's work in progress.
Yeah, it is. But just to kind of talk about that, you're right. Clinical psychology, I think those of us in simulation, we don't use them enough. I mean, these are folks that learn psychometrics as part of their programs. Like they've got evaluation down to the science, obviously, because that's what they do. And so I think they're tired of me wandering over there every so often, but that's the whole reason, is that you've got use other people's skills. Why not?
So, Nicole, thank you for coming on today. I learned a ton, and I appreciate the fact that you gave a unique perspective on what you're doing, great things in Canada there. And I look forward to potential future collaborations with you.
Yeah, thank you.
So to our listeners, thank you for listening today. In future podcasts, we will continue to discuss key aspects of simulation healthcare education with experts in the field. Bye for now.